Pulmonary function tests, such as spirometry, are vital for evaluating respiratory disorders. This video covers spirometry in detail, including normal values, interpretation, clinical significance, indications, contraindications, and quality control measures. In spirometry, comparing results to predicted normal values is crucial. These values depend on age, height, gender, and ethnicity. Calculating predicted values involves using regression equations. Measured values are then expressed as percentages of these reference values for standardized interpretation and identification of abnormal lung function. Choosing appropriate reference equations for the specific population is vital for accurate results. In the Advanced Flow Volume Loop Interpretation section, we analyze the flow volume loop, a graph that shows the relationship between airflow and lung volume during breathing. Abnormal patterns in the loop help us diagnose respiratory disorders like asthma or COPD. Pre- and post-bronchodilator testing assesses the reversibility of airflow obstruction in obstructive lung diseases, like asthma, and distinguishes them from restrictive lung diseases characterized by reduced lung volumes. This information guides further investigations and treatment strategies. In obstructive lung diseases, a reduced FEV1/FVC ratio indicates airflow limitation. This ratio is important for assessing disease severity and monitoring treatment response in conditions like COPD, asthma, and bronchiectasis. Restrictive lung diseases are characterized by decreased lung volumes, resulting in reduced respiratory function. Spirometry measures such as forced vital capacity, FVC, are used to detect these diseases. Decreased FVC is observed in conditions like interstitial lung disease, indicating reduced lung volumes. Evaluating FVC helps diagnose and monitor restrictive lung diseases. Mixed spirometry patterns encompass a combination of both obstructive and restrictive features. These patterns can be observed in certain respiratory conditions such as chronic severe asthma or obesity hypoventilation syndrome. In these cases, spirometry shows a decreased FEV1/FVC ratio, indicative of airflow limitation, as well as reduced FVC, suggesting restricted lung volumes. These combined features reflect a dual pathology affecting both airway caliber and lung compliance. Recognizing mixed spirometry patterns is essential in order to tailor the management approach to address both obstructive and restrictive components. Bronchial provocation tests are utilized to assess bronchial hyperresponsiveness, a characteristic feature of asthma. These tests involve the administration of specific agents, such as methacholine or histamine, to induce a temporary airway constriction. During spirometry, the patient's lung function is measured before and after the administration of increasing concentrations of the provocative agent. The degree of airway reactivity is then assessed by measuring the change in FEV1. Interpreting bronchial provocation test results requires familiarity with the different methods, such as the determination of a provocative concentration triggering a 20% decrease in FEV1, PC20. These tests aid in diagnosing asthma, assessing treatment response, and guiding therapeutic adjustments. The diffusion capacity, measured as DLCO, evaluates gas exchange across the lung membrane. Reduced DLCO is common in lung disorders, indicating impaired gas exchange. Interpretation involves comparison to predicted values, considering age, hemoglobin concentration, and lung volume. DLCO aids in diagnosing and monitoring pulmonary vascular diseases. Assessing lung volumes is important for diagnosing and monitoring respiratory conditions. Techniques like body plethysmography and gas dilution measure total lung capacity, TLC, residual volume, RV, and functional residual capacity, FRC. These measurements help to understand and manage conditions like COPD and asthma. Spirometry is a widely utilized diagnostic tool, but there are certain indications and contraindications that need to be considered before performing the test. Indications for spirometry include the evaluation of respiratory symptoms, monitoring disease progression, assessing treatment response, and preoperative assessments. Contraindications for spirometry are minimal but should be considered to ensure patient safety. These include recent eye surgery, recent myocardial infarction, and a recent thoracic or abdominal surgery. It is also essential to ensure that patients can understand and perform the necessary maneuvers required for spirometry testing. Understanding these indications and contraindications helps guide appropriate utilization of spirometry and ensures the safety and well-being of the patients. Maintaining high-quality standards in spirometry testing is crucial for accurate and reliable results. Understanding proper technique, acceptable criteria, and common pitfalls is essential in ensuring the validity and reproducibility of spirometry data. Technique errors, such as incomplete expiration or coughing during the maneuver, can lead to inaccurate results. Acceptable criteria, such as the repeatability of measurements and the presence of a satisfactory start and end of the test, should be met to ensure data quality. Common pitfalls influencing interpretation include poor patient effort, improper calibration of the equipment, and improper use of reference equations. Being aware of these potential issues allows for appropriate troubleshooting and enhancing the accuracy of spirometry results. Interpreting spirometry results in specific patient populations requires special considerations. Factors such as age, growth and development, pregnancy, and neuromuscular disorders can impact spirometry interpretation. In the elderly population, distinguishing between normal age-related changes and respiratory pathology becomes important. In children, reference equations and interpretation criteria specific to their age group are utilized. Pregnancy affects lung volumes due to physiological changes, and adjustments need to be made when interpreting results in pregnant individuals. Patients with neuromuscular disorders may demonstrate abnormal spirometry patterns due to respiratory muscle weakness. Understanding the impact of these conditions on spirometry results aids in accurate diagnosis and appropriate management strategies. In conclusion, spirometry plays a crucial role in diagnosing respiratory disorders. By accurately interpreting spirometry results, clinicians can make informed decisions and provide appropriate treatment. Understanding the various aspects of spirometry ensures valid and reliable data for patients with respiratory diseases.